Life expectancy should not be based on zip code or whatever your socioeconomic status is. It's a shame that you can see such disparities in the same city.
North Philadelphia is this wonderful community of African Americans and Hispanics and Latinos. It also is a community that needs help.
People are hurting. We don't always see it, but people are certainly hurting.
The challenges are many, just simple things. Going to the pharmacy to pick up your medicines, going to the doctor and having to take 3 buses to get to the doctor.
A full-fledged supermarket, there isn't one in this community.
You don't see big supermarkets in North Philadelphia. So the opportunity to buy healthy food, an apple, a pear, to have choices is incredibly limited. In fact, places like North Philadelphia have been termed food deserts because of the lack of choices.
In a community where the unemployment rate tends to be higher and you're thinking more about living paycheck to paycheck, I think those things as far as like transportation, getting to the supermarket, those things are tougher for people who have to make those kind of decisions of, do I go to the corner store, which is more expensive, or do I go to the supermarket, which is outside of my community?
It would be nice to have, access to healthier foods without always having to catch the bus. We do have, our corner stores, our mom and pop shops, which of course, because they're smaller stores, could be a little bit more expensive. So those are some of the barriers that, we face in terms of access to healthy eating.
It's a poor community. Some of the poorest zip codes in the country are here in North Philadelphia. If you look at the news, all you hear about is the violence and the stabbings and the shootings. But I think we need to remember, heart disease remains the #1 killer of both men and women in this country and around the world. And it's also the #1 killer of men and women in communities like North Philadelphia. People in this community are passionate about who they are, their families, and they want to be healthier. And they do come to the doctor, and they do their best to take their medicines and do everything that the doctor tells them to do. But there are incredible challenges that they're faced with every day that make it difficult for them.
I like the energy of the community. When people feel strongly about something, they feel strongly about it. There's that passion that's there. They see that change coming, and they want it, and they want to be a part of it.
The news is certainly missing all the positivity that goes on. There's more good in all of us than bad.
I think you have a group of people who are proud of their community, but they want to see changes happen. They want to see improvements happen. We have a community development corporation that was started in 1998, the Bluff St. John Community Development Corporation, and so we do a lot of work in the community.
Most of what bringing everybody together does is do whatever we can to give our youth and families a positive outlook on life. If there are things that they need, we do the best we can to provide that support, whether it's academic support, whether it's social skills, and there are a number of programs that are part of BET that's been a part of the Logan community for over 20 years. When we have our community events, it's amazing how many parents, are excited about coming out when there happens to be a free health screening, blood pressure, whatever it might be, because people don't go to the hospital as much, whether it's because they don't have insurance, because it's too far and they don't have transportation.
I see this as a wonderful opportunity for us to really have a positive impact on a huge population of patients if we all do the right thing and work together.
People won't change until they're educated about what they need to make changes in.
There's an opportunity for, increased adult basic education. In order to help our students, help our children, and help our community, it's important that we're on top of our game a little bit more. We know that what you do in a neighborhood affects a city. What you do in a city affects your state.
This is a wonderful opportunity for organizations like the American Heart Association to focus many of its efforts on the community level, to partner with large corporations, to partner with government, to partner with community organizations, barbershops, churches, places of worship, to focus on the needs of the community and to address those needs.
The relationship with the American Heart Association so far has been awesome, and I'm looking forward to continuing that.
The American Heart Association has already shown us that, they're supportive of our community. Whatever we can do in partnership to help our children, our young people, our families, and our community, we appreciate their support.
If we can do that, we will impact favorably the healthcare of people that live in North Philadelphia, but that will also have a domino effect on everyone living in the city of Philadelphia.